And this internet. Oh my God, we are live. Thank you for joining us. You are watching Afrisent with BT, our YouTube channel here, where we're all about the diaspora and the sentiments that come from the diaspora. But these past couple of months, we have been hosting amazing guests that have talked to us about transitions. My name is Beatrice. I'm a mom, I'm a wife, I'm a nurse by profession, I'm a sister, an aunt, what else? A daughter. And today I have an amazing guest. I've been sharing several people. Unfortunately, they've been mainly the medical field, maybe because that's where I'm at. But if you're out there and you are part of a different astronomy, like a totally different profession, please reach out because we want to hear to chat with you and to hear your journey so that young people can be inspired. So today I'm so honored to have Dr. Joyce on the show to talk about transitioning and she's going to school us because I messed it up. You will see, I'm going to tell you. Transitioning from radiography to medicine and then to radiologist. So I think I got it right. I'm not so sure. Dr. Joyce, thank you
Yes,
so much for having us. Welcome to the show. Um, I will let you take over. How are you? Who are you? What makes you wake up in the morning? What makes your heart beat? Please. And do you want? Let me know when you want. Dr. Joyce is an amazing teacher, so she has some slides for us. So let me know when you want me to just
you
kind of
can
put that
start
slide
right
in
away.
there.
I'll just talk through them. Yeah, so thank you,
All
Beatrice,
right.
for having me.
Mm,
Yes, I'm again Joyce
yes.
Naika Kasuja. I'm a medical doctor, specifically a radiologist in Uganda, and that's in East Africa. And I'm so
Mm,
happy to be here with Africent with Bits to share my experience of how I transitioned. As she has mentioned, I was a radiographer for a very short time though. As a radiographer, then I transitioned to medicine, and now I'm a specialist in radiology in Uganda. So I'll just be sharing my journey and my experience. And I also noticed there's a lot of confusion between who a radiographer is and a
yes.
radiologist is. So I'll be sharing that. So I'm very happy to have you, viewers, and I hope to get feedback on this. Thank you very much. So basically,
Yeah.
that's who I am. Yes.
Mm. I'm excited. Dr. Joy, you and I met in Makerere University. And
Yes.
it's amazing because people who don't know, when we all come in, I think we're a batch of about 180, but we were
Yeah.
all different professions.
Yeah.
Like we had dental surgeons,
Mm,
pharmacists,
mm,
radiographers, nursing, and
mm,
MBCHB, which who medicine, which most people think like Makerere University Medical School is about. So you was
mm,
unique because I didn't even know, like going into medical school, that we had that branch of radiography. And I know that, and
mm,
then I discovered we have a diploma school like right
mm.
next to us. Does that diploma school also have radiography?
Yes, and actually for a very long time, it was only
Mm-hmm.
diploma in radiography, and then the other
Mm,
group was the radiologists who are physician. So the diploma in
yes.
radiography were very limited in that they could only take the X-rays and things like that. They could only perform many of the
Mm,
ultrasounds, and that meant that the bulk of the work was with the radiologist. So the bachelor's degree was sort of a bridge between the two, so they can take the images as well as be able to
mm,
perform diagnostic procedures on some of the simple cases that the radiologist where they don't need to come in. So that's how it came about. I think we
mm,
are the third year, either the third or the fourth year,
mm-hmm,
undertaking that
mm,
bachelor's degree in radiography at Makerere University at the time.
mm. Yeah. So
Yes, so it was
I'm
also
going to
very
put up the
new.
slide so we can go
It's
through the
okay.
slides, and then after that we can have a
Yeah,
free
so
chat just with questions and all that, so that because I believe that most likely many of the questions that I have or the viewers have already been answered in this slide. So I'm going to put up the slide so that we go through the
yeah, and
slides,
feel
and
free
then
to
if there's anything
interrupt
else,
anytime.
I
Feel free to interrupt. Yes, so as you put the slides, I'm basically going to talk about the pathway to becoming a medical doctor in Uganda and
mm-hmm.
eventually becoming a
Yes,
radiologist. That's the general pathway, but I'm also going to discuss my
yes.
unique journey which is different from what is presented. So in Uganda,
Yes.
you graduate from high school and immediately, it's not like the
Yes.
US where you are, Beatrice, you immediately enroll into
Yes.
medical school for 5 years to do a bachelor's of medicine and bachelor's of surgery
Oh.
degree to become a medical doctor. And after the medical doctor, there is 1 year of internship, which is not reflected in this pathway. And after that 1 year of internship, then someone can qualify to perform as a general doctor. So a general doctor in Uganda basically does a wide range of procedures and diagnoses
Mm.
patients, treats
Mm.
patients, can do some minor surgeries as well.
Yeah.
Then from
Mm.
being a general doctor, many people choose to stop at that level in Uganda. However, some few
Mm.
people choose to progress like I did. Okay, so you
Mm.
can specialize in any of the disciplines that we've heard about. They can be obstetrics and gynecology, it can be pediatrics, dealing with children, it can be surgery,
Mm.
dealing with surgical conditions, it can be ophthalmology, dealing with eyes, it can be everything. But you can also be
Yeah.
radiology, which is a very interesting discipline that I'm going to discuss, a discipline that is very close to
Mm.
my heart, and I think a discipline that I landed in by chance. And
By
so my own
chance.
journey, yeah, so that's a general pathway, and it takes around
Mm.
9 to 10 years really to become a radiologist in Uganda, which is versus the US where it takes around 13 years. That's from high school, by the way. I'm not counting the
Oh
years
wow.
before. In the US, it's around 13 years. And the main difference is because in the US, we have pre-medical school,
Mm.
which is around 4 years. So that increases the number of years,
Mm.
but we do not have that in Uganda. I'll keep contrasting because we are from Uganda and Beatrice, you're in the USA. So I'll keep contrasting so that our
Yes.
viewers can make sense of what we are talking
Yes.
about. Then my own
Mm.
journey, as
Don't
you're going
you,
to see that slide,
the A levels,
yes.
wouldn't you consider A level in that gap? Like, so that means I can apply from high school straight to my career, or I have to go through A level, the A
Oh,
level
high
part
school,
for
I meant
Uganda.
A level as well, like from S1 to
Oh,
S6. Yes, but some people call it
okay.
college.
S1 to
But
S6.
it's,
Okay.
yes, that's when someone is around
Yeah.
17 or 18 years of age.
Yeah. Okay.
When
Okay.
they
Because
graduate
for
from
us, I
S6.
think here they have high school 4 years and then join college. So that 2 years we
Okay.
carry as A level, they carry as an associate. And they can probably
Okay.
do, any pre-med courses like, become a researcher or biochemist. Like they can literally get a profession if they wanted to stop at that point,
Yes.
depending on what the majors they've done. So, okay. All right.
Okay,
So
yeah,
let
so
me
that's the
just keep
main
going.
difference. Thanks for that clarification. You remember back
Mm.
here, that's all called high school, but I
All high
know
school,
there are differences.
yes.
Yes. So
Yes.
my journey is slightly different from what I have projected. As you can see,
Mm.
there is a, you can go back the next slide, just that one.
Mm.
There is
Mm.
a different color. That's red, I think, and orange and yellow. Yes, so
Mm.
when I finished high school, I enrolled for Bachelor's of Medical Radiography. And the reason this wasn't exactly my first choice, in fact, I didn't know
Mm.
what the course was about. I used to gravitate towards mathematics and physics. So when I was applying, one
Mm.
of the teachers helped me put that course. Okay, and definitely
Wow.
I thought from the way I used to perform that I'll definitely get medicine. And I actually
Yes.
narrowly missed medicine by only zero point 0.8 points, not even a point, but 0.8 to get medicine. And I was
I
offered
can
medical
imagine.
radiography on government.
Mm.
So when I was offered radiography on government, it was
Mm.
very hard not to take that choice because it was a sponsorship, and everyone who looked at it is like, you cannot, dump your medical degree. It's still a medical degree. And at that time, I didn't
Yes.
really understand it. So I was like, okay, I have this course on government sponsorship. Let me do
Yes.
it. But
Yes.
halfway through the course,
Mm.
we used to share courses with medicine students and all that. And at that
Yes.
point, I hadn't really realized I was doing radiography. The first 2 years. In my
The
mind,
first
I
2 years
was
were
doing
in your mind, you're like,
medicine.
no, I'm doing medicine. I'm in medical
Yes,
school.
and I
I'm
used
good.
to excel actually in those courses. So when it came to the point of separation, that was around the
Mm.
second year, it hit me hard
Yes.
that, hey, I'm joining my third year, and somehow I couldn't accept that. So I went to the dean and other, doctors in the office, and I told them my issue. I wanted to switch. They told me, you're switching
Yes.
too late. They told me I wanted to switch, and like, what are your reasons? Like, they told me, well, no. They looked at my marks and everything and where I come from.
Yes.
like, why didn't you apply straight away for private? I was like, I wasn't sure. I didn't even know what this course was about.
Oh my
It's like,
God.
even right now, you don't know what it's about because you haven't yet started doing it, actually. You've been sharing courses.
I know,
But then,
sharing, doing the
and
physiology
yeah, I'm talking
together.
about the role of mentors, really. That's the point I want to stress because for me, my journey, I don't think I would be where I am if it wasn't for the mentorship that I got. I
Yes.
think I would be because I was totally confused in medical school, totally confused because maybe I didn't go back to where my passion for doing medicine came from, but I lost someone very
Yes.
dear to me as a
Mm.
child, and I felt like
Mm.
something wasn't right. They hadn't done enough. And so originally I used to gravitate towards mathematics and all that. So I thought I'd be an
Mm.
engineer, actually, aeronautic
Yeah.
engineer. I never even thought I'd be a doctor.
Oh
And then
wow.
I used to argue out my points, and my auntie said I talk like a lawyer. So at one point I believed I would be a lawyer. I transitioned through
Yes.
different interests. But when I
Yes.
lost that person that was really dear to me and close to me, that's when my love for
Mm.
medicine started. At the same time, I
Yes.
had an uncle who was a doctor,
Mm.
and he always looked
Yeah.
at me and I was perform. I said, this girl will be a doctor. So he started calling me a doctor actually from a
Oh.
very, very young age. So I aspired to that, and even going to Gayaza and how I used to perform there, I
Yes.
definitely knew that I would get into medical school. And of course,
Medicine.
things turned out how they
Mm.
did. I was offered medical radiography, which actually people believe was
Yeah.
a very good course. At the time, I didn't know it was, but I'm actually very glad that I took that journey because I wouldn't be where
Mm.
I am now. I don't think I would have chosen to become a radiologist if I hadn't started as a
As a
radiographer. If I hadn't started as
radiographer.
a so I
Yes.
know, yes, I'll talk about God. I think God put me on this path somehow
Yes.
because He could have
Yes. He
taken me
orders the
to
footsteps of the
and do
righteous.
medicine straight away. I had the points to do them, the medicine from
Mm-hmm.
another university. I wanted my career, and
Mm-hmm.
the fact that I decided to start my career and do radiography sort of set me on this path. But I'm still talking about
Yes.
the role of mentors. When I went and spoke
Mm.
to these professors and all that, they looked at me as a very young girl who was confused and told me, you know what, you have only 1 year to
Yeah.
go. Why don't you finish this course?
Yes.
And if you still really want to do medicine, they asked me my reasons and I
Mm.
articulated them very well. If you still want to
Very
do
well.
medicine, then we shall
Mm-hmm.
support you. So I
Mm.
finished, and as you know, radiography in Uganda was, especially the bachelor's radiographers, it was really new.
Yes.
It was interesting. It was different,
Yes.
and there was a hot market, a big market actually, even just not in Uganda, but even in the UK and surrounding countries,
Everywhere.
Ireland and all that. So at that
Mm-hmm.
point, I traveled a bit, and then I met an Australian who interested me in going to Australia. And I actually
Wow.
applied for a job. I did the interview and passed. So, but at the
Oh
same time, inwardly,
wow.
I wanted to become a doctor.
A
So
doctor.
the job invitation came
Mm-hmm.
through when my application also for medicine and surgery I applied.
Oh my
Came through. I actually only worked for
God.
1 year. That I worked for 1 year after radiography, and I'm very
Mm-hmm.
glad for that 1 year because it was a big exposure. It opened my eyes to what radiography was, to what radiology was, and its contribution to medicine, which I actually hadn't really
Yes.
appreciated when I was in school. But
A
when I started
student.
working, I actually
Yes.
appreciated that because we are really
Oh.
involved in patient management. And sometimes
Mm.
it was a difference between the right, correct treatment and the wrong treatment for the patient. So that
Yes.
really opened my eyes. And I told myself, I talked to my auntie, I told her all these options. She asked me, what do you really want? I told her, you know what I want? From when I was a child, I wanted to be
I
a doctor.
know.
She's
I want
like,
to be
then
a
when you go to
doctor
Australia,
too.
you're going to be a doctor. I told her, no, I'm going to not remain a radiographer. She's like, then I advise you stay here and follow your dream. As well as
Wow.
these other professors at
Mentorship.
Makerere.
Mm.
Yes, actually, there were some in radiology. They wanted me. They even started calling me a radiologist when I was still a radiographer. And I told myself one time I wrote an article in the Gift Goes On magazine. I don't know if you remember it. I've been
The
looking for
gift
that
goes on.
particular. Yes,
Yeah.
it was a magazine by the Christian Medical Fellowship.
Yes.
Yes, so I wrote an article and I actually told my aspiration was I was looking to be a first rate radiologist. And here I was a
Yeah.
second year radiographer. So some of the things we prophesy them, in our lives. That's what I
Yes.
wrote. I hadn't even
Yes.
applied. I wasn't a
Yes.
doctor, but I was looking at becoming a first rate radiologist.
Yeah.
So fast
Red.
forward, I decided to let go of the Australian job. All my
Mm.
colleagues actually had traveled, and right now I think I might be the only one in that cohort in the country, or one other person. I'm
Wow.
not so sure. We're 13 Ugandans, all of them are
Oh
practicing in the diaspora.
wow.
I'm the only one. So I chose to remain in
To
Uganda.
remain, and you
And
know what, Joyce, that's very important because you told, I know a friend of mine, Nixon. You know Nixon. He's a doctor
Yes,
of
yes,
doctors now, but
yes, yes.
he is very very intentional. Like he's had every opportunity. Went to Duke University, came back for his PhD in Seattle, and he chooses. He's like, my calling is Uganda. My calling is
Yeah.
Uganda, and I'm going to serve in Uganda. So he's had his master's and his PhD in America, and each time they've offered him a job, he said, "No, my calling is in Uganda." So that's important to know exactly where God is calling you to. And what you've also mentioned, it's funny. Today we had this family prayer meeting, and the thing we're praying for our children. But one of the things my sister prayed for is that so that we, as adults in their lives, can recognize God's, like, what is it that they're meant to be. You see your uncle saying Musawo wange, like
Yeah,
calling you what you're
yeah.
supposed to be. So yeah, anyway, carry
Mm,
on. Yeah.
yeah. So basically, that's how I joined. So you can put that slide.
Okay.
You can put
Okay.
that next slide. But as you put it, so I did that medical radiography, practiced as a radiographer, went back to
Okay.
medical school, and I did medicine and surgery, graduated as a doctor. So when I graduated as a doctor, the options were limitless. I could have chosen to do
Yes.
anything. Public health, general surgery. I actually gravitated towards the surgery because I think I'm a procedure person or more of a hands-on person. So I
Yes.
gravitated towards more of the surgicals. But then something happened when
Mm,
I finished medical school. So the rest of the journey, of course, is obviously the same. And you can put the next slide where I'll share a story of my friend and why I chose to go back in radiology. So I'm going to share a story. Okay, briefly before I share that story, just for our viewers, Beatrice, you and me, we understand what radiology is. Okay, but I
yes.
hope all our viewers can be on the same page. And I just decided to put this briefly to describe what this discipline is. So radiology
Yes.
is actually a branch of medicine. It doesn't have anything to do with radios.
No.
It's a branch of medicine,
Yes.
yes, that uses medical imaging technology to both diagnose and treat diseases. We not only diagnose, most people think radiology is all about
And
diagnosis,
treat.
but actually there's a lot of treatments that do happen in the
Treating.
radiology and radiotherapy departments. So I also wanted to distinguish for us who is a radiographer because I'm a radiologist and I've been both of these things as I've explained.
Yes.
I started off as a
Yes.
radiographer, did medicine, became a doctor, and then specialized to become a
To become
radiologist.
a
So who
radiologist.
are radiographers? Radiographers are
Mm.
healthcare professionals that operate these medical imaging equipment most of the times to produce these images that you look at. Like, for example, we have a chest x-ray up there. In the middle is an MRI image, which mainly looks at soft tissues. The last image is a CT, or what you call a CAT scan, that looks mainly at bone, but of course it can also look at soft tissues. Then we have one of the equipment here. This was a CT machine. So that's the equipment that we have to produce these very beautiful images. And it takes skill as well as
It
technique
does.
for them to
It does.
produce. But on the other hand, a radiologist is a medical doctor. So first and foremost, you cannot become a radiologist without having the primary degree of
Of
medicine and
medicine.
surgery. You have to have that. That's why I went back to do medicine and
Yes.
surgery so that I can become that first rate radiologist that I talked about when I was
Wow.
still young. Okay, so they are
Mm.
medical doctors, and after these radiographers are produced these very
Mm.
beautiful images, which are diagnostic. Then we are interpret those images using the vast knowledge that we have acquired in medical school, knowledge of pathology, physiology, embryology, for example, in pregnancy,
Yes.
knowledge of biochemistry, microbiology, all that you tie it in together with
Wow.
with the images that you're seeing to come up with a diagnosis. Okay,
Yes.
but we don't only diagnose. Many cases, it's not yet so fully developed here. We do actually also treat diseases, and I'll talk about that using the same medical imaging technology. So that's what radiologists are, and I hope I've explained it clearly. I think radiographers in the US are called radiologic technologists, right?
I think so, actually. You know what? I
Yes, they are
didn't do
called
my
either
research on
medical
that.
imaging technologists or
Mm.
radiologic technologists. But in
Mm.
Uganda, we use a UK nomenclature where we are called radiographers. I think it's the same as Australia,
Mm.
Ireland, and all that. They are called radiographers. But when you go to the UK, they are radiologic technologists, but it all means the same thing.
It's the same.
So
And
basically,
the treatment part is very big here because one of my sisters in law, she's a nurse, but she works with a radiologist. Like they do the intervention medicine,
yes,
radiology.
yes,
Yes.
yes,
So I
yes. And
didn't
when
even
we
think
talk
about
about
that, but
that.
that, yeah.
Yes, so most people, of course, in Uganda, we are not so developed. We do still do interventions, but not
Mm.
at the at the level where it's done like in
Yes.
the US or other developed
Mm.
countries, but we do still do
Mm.
a bit of interventions, which actually does save lives. So that's the
Okay.
difference, and that's
Mm.
the radiology. So why radiology for me?
Mm.
Okay. It's very, very personal why I actually finished medical school and decided to go back to do radiology. And I'll just
Yes.
quickly tell you a story of my friend Ronald, and these are not his real names. I'm just using them for illustration purposes.
Yes.
So Ronald was a friend of ours, or a friend of my family, that died 6 years ago of lung cancer.
Mm.
Ronald was a larger than life character. He was a
Mm.
family man, as you see in these cartoons. He loved
Mm.
his children. He was a very enthusiastic young professional. You can just look on that one slide. He was an enthusiastic young professional.
Mm.
And 1 year ago, before his death, he developed a dry, irritating cough. So when he
Mm.
developed, you can proceed, at that dry, irritating cough,
Mm-hmm.
he sought medication. It was just a dry cough, from
Mm.
various medical clinics and pharmacies around town. That was around
Mm.
Kampala.
Mm-hmm.
And when they gave him the syrups, he didn't improve. Okay,
Mm.
they kept on telling him maybe it's an allergy, it's just a dry cough, it should resolve with this and that syrup. He took
Mm.
different concoctions of syrups, antibiotics, anti-allergy
Mm.
medications with mixed results. So
Mm.
with time, this friend of ours lost hope in the system,
Mm.
basically, and started self-medicating. And he didn't
Mm.
think his situation was very serious until, next slide, until one day he developed sudden chest pain. Okay, so when he
Oh.
developed sudden chest pain, all of a sudden he became breathless, he started coughing up blood, the cough worsened, and it
Mm.
occurred to him that his problem is perhaps much more serious than what he had anticipated.
Oh my
So he
God.
checked himself actually into the hospital, and the doctor there, examined him, took the history, and decided
Mm.
to request for several investigations, among which were radiological investigations. So
Mm.
one of the investigations that was requested was a chest X-ray initially that
Mm.
showed a lung mass. These are not his actual images, but these are for
Mm.
illustration purposes, for anonymity purposes.
Mm.
So they took chest X-rays that showed lung lesions that looked like lung cancer, but they were
Oh.
not so sure about it. So they
Mm.
request for further investigation, which the next image is a CT scan. It's a cross-sectional image of the chest,
Yes.
and it focuses on the area around the blood vessels. That's the mediastinum, and it shows lymph nodes, metastatic,
Mm.
nodes in that area. So at that point, it was already metastatic disease.
Mm.
Subsequent investigations included a biopsy, which indeed confirmed that this was lung cancer. There were other complications in his chest. Part of his lung had collapsed. He had some effusions, that he had some fluid in the chest as well. And
Mm.
then they decided to do more blood tests as well as radiological tests of the
Mm.
abdomen, which showed that these masses had already gone actually, or the
Mm.
lesions had already gone to the liver. So it was a stage 4 disease at a point of
Mm.
diagnosis. This is the time when I was trying to wonder, should I do general surgery? Should I do radiology? I wasn't sure, really. And
Mm.
so when he was diagnosed finally, as a doctor of the family, everyone asked me, how could this happen?
Oh my
Why was he
God.
diagnosed so late? He was given a very poor prognosis, 6 months at most to live. And
Oh.
even I couldn't come to terms with it. So
Mm.
this opened my eyes of the dangers of diagnostic delays
Yes.
actually cause death.
Yes.
And it opened my eyes. Well, I knew it already, but it emphasized the point that the radiology is indeed the eye of medicine. We have
Yes.
other eyes of medicine, but it's one of the main eyes of medicine that you may palpate
Yes.
a mass of the condition. But without requesting for some of these investigations, you won't really know what's happening inside
Mm-mm.
the
In the
condition.
body.
So I
Mm-hmm.
imagine if the various medical clinics where I went, I'm not sure if it was seen by a physician also who saw him. They requested even for just a chest X-ray. Perhaps
A
my friend
chest
might
X-ray, the
run at that.
cheapest imaging.
Yes, so it was never requested. He kept on having what looked like an allergic cough, a
Oh,
dry, irritating cough. It was treated with several antihistamines, those anti-allergy
oh my
medications.
God.
And I was bombarded with all these questions. So my eyes open as like, radiology, next slide, is indeed the eye of
Of
medicine. So
medicine.
within a short time, Ronald had he had a young, beautiful family, and he wanted to fight.
Oh,
So even if he was given a very, very bad prognosis, he decided to start chemotherapy, and he died within a month of starting that
chemo.
chemotherapy.
Oh
So
my
even though we knew his prognosis was poor, actually during
God.
that chemotherapy, he developed very multiple painful complications, and it was
Oh.
very, very, saddening to watch him, and he succumbed to his illness. So when it succumbed, questions remained. Questions, myself, I had questions. I'm like, what could have been done? So I decided to join patients like Ron, were the reason why I joined radiology, why I decided to leave everything else. And I said,
Yes.
I have to be part of this profession that is very
Yes.
central to medicine, even if
Yes.
still obscure and people can't see it, so that I
Mhm.
advocate and people see the role
Yes.
of radiology in both the early detection of diseases, because some cancers are treatable. Okay,
Yes.
the
Yes.
diagnosis, timely diagnosis, patient staging, as you said, we were staged but
Mhm.
staged late, follow up. Okay, imagine he had been on treatment, we would have used the same radiological procedures to follow
Mhm.
up if these lesions have been,
Mhm. If
completely
you're
treated
responding,
correctly or
if he was
responding
responding.
to the
Mm.
chemotherapy. So patients like Ron, you can go to the next, are the driving force. They are my main motivation why I
Mm.
did what I'm doing. And so I've already mentioned it's the eye of medicine and it helps to save lives. So in
Mm.
a way, I know I'm supposed to talk about transitions, but I couldn't help
No,
but talk about
this is
this very,
perfect.
very, uh, the radiology profession that is very, very close to my heart. And
Mm.
many people do not understand what it is, yet it's very integral and very central, okay, to patient
Mm.
diagnosis. Where it matters most, it should be used. And actually, that's me trying to look at a patient's x-ray and interpret it
Mm.
to see if there is any problem and the patient can be helped. And
Mm.
so, yes, that's how I transitioned, and that's how I went back. I started as a radiographer, as you've seen. Thought I'd go and do medicine and become a surgeon, actually. In fact, remember when we used to say in school, we shall become neurosurgeons. After we had read Ben Carson's books, I wanted to become a neurosurgeon.
No, Joy, it's so funny you say this because I think that's the biggest thing we have in Uganda. We have this amazing teacher who teaches the women. My mom owns a non-profit organization in Uganda that teaches women, and she just had like her thyroid checked out, and we're asking ourselves, is it a cyst, is it a mass? But the person she went to see didn't tell us anything. There's an imaging that could tell
Mm,
us something, but they're not telling us. And that most times we think we are saving the patient money by not asking them to go see do these radiology tests, or we are in a practice of not thinking about sending, like we do lab work, okay, go to the lab, but we never think about radiology, like let's do some investigations there as well. I think the practice in Uganda, we need to do more of that because people shouldn't die if we can do something about it. So
yeah, definitely.
yeah,
So diagnostic delays are real.
they're
They are
real.
real, and radiology is one of the places that
Yes.
has been underutilized or even abused, because now we are
Mm,
getting a lot of infiltrations by quacks and people
yes.
like that. And I won't go into those details. So back to our topic, transitioning. So to
Transitioning.
anyone out there who's a radiographer,
Mm-hmm.
okay, and you like to become, first of all, there are a lot of opportunities in radiography. As I mentioned, these two professions work hand in hand. They are
Yes.
different professions, but they do work in hand, and they are dependent on each other. As a
Wow.
radiologist, I cannot interpret what hasn't been provided to me. I have to wait for a very good quality image. It has to be of diagnostic quality so that I
Yes.
can be able to interpret it. So both
Interpret
these
it.
professions, I'm not saying that being a radiologist is better. That's what personally I wanted to do, because I wanted to be more involved in patient care as a doctor,
Yes.
and that had
Yes.
been my dream. But even for those who have chosen to just become radiographers, I still think there are a lot of opportunities. There are a lot of
Mm.
opportunities, especially in the diaspora, okay, where
Yes.
people have traveled and they can bring back that knowledge, because we have some of our colleagues, radiographers, that
Mm-hmm.
have traveled, but every year they bring back their knowledge. We have conferences every single year, and actually you see a picture of one of them. He's actually a radiographer who was teaching radiologists. Okay,
Wow.
some of the things he had actually learned in the UK. So there are lots of opportunities they can still practice. But for anyone who wants to transition, whether it's from nursing or pharmacy, because
Mm.
I've also seen pharmacists transitioning, it's basically the same process. You have to go back and do the medicine and surgery.
Medicine.
There are no shortcuts.
Oh,
If you
wow.
want to be one of those medical specialists, okay,
Mm.
ENT surgeon, neurosurgeon, whatever you want to be, you have to do medicine and surgery. And if
Mm-hmm.
you studied in Macquarie University at the same time, there is
Mm-hmm.
an allowance. That's what I didn't talk about. When I went
Mm-hmm.
back, I didn't do all the 5 years. Okay, I was
Yes, because you
exempted.
had done your 2 years of basic, like
Yes,
physiology,
I was
anatomy. You had
exempted.
done the basics.
Yes. I had missed two course units of
Mm-hmm.
medicine, so I had to do
Mm.
those two course units before I could proceed to third year. but I did them at the time was very, very short. You know, time is short when you're busy. I think it's the
Yes.
people outside who are seeing that the time, you know, so much, I've spent so much time.
But you don't feel it.
But I didn't even really think about it because imagine 3 years then, radiography is no longer 3 years, but I was doing 3 years then. And then 3 years of radiography,
CHP.
3 years of medicine. Okay, 3 and 1 month, I should
Yeah.
say. That's 6 years. Only 1 year more than
More,
someone
yes.
who has done the 5-year course. So it's like in 6 years, I actually had to my 2 degrees.
2 degrees. So my question is, so do you is there like a special slot they hold just for re-entries? Do you compete with the nurses trying to get
You
back in
compete. You
medicine?
compete with everyone
But
else.
the process is
You
the same.
compete, but you have to be exceptional. From what because there's so many people who have applied over the years and didn't get. So your grades have to be exceptional.
Yes.
Some of us were in leadership and things like that, and I think
Yes.
those really matter. I was also immediately I finished. I was working in Mengo where I was teaching as well,
Oh,
and
wow.
basically it shows that you want to continue learning. Those are some of the reasons I was given really when I tried to probe because some colleagues I know were not given. It's
Yeah.
very, very competitive. They actually don't like it when you do a bachelor's degree and go back to do another bachelor's degree.
Yes,
They don't
because
like it. They say that
they
that's
consider
horizontal
horizontal
progression. The
growth.
degrees
Yes.
are vertical
Linear.
progression. But in my case, because I think even as a student, I had expressed interest, I do not
Yes.
know. And basically, your grades have to be highly competitive. And
Competitive.
then
And
you
so
have
remind us
to
again. So remind us again. Once the list for the kids joining like has come, Makerere University has put out a list for people who are going into Makerere, MBCHB or medical school generally. Is that the point at which you also go pick up the forms?
Yes. So once the list of private,
Private
it has to be the private because the government, remember, they apply when they're still in high school.
in school,
So when the
yes.
list for private applications open, you're supposed to pick a list. But this time, you do not pick for the same list as theirs. There's a special application form. It's called a diploma stroke degree,
Diploma stroke.
depending on what
Where do we pick it
degree
from?
entrance. Sorry? The same
Where
place,
do
the same building, Senate building.
Senate building? So you choose the form
Yes,
that
but
says
now all the
diploma stroke
applications are
degree.
online, so I'm not even sure. I know that with COVID, most of the things are done online, and the
Okay.
information is provided where to pay, you fill everything, and then you return. So
Okay.
it's online. So if you did a diploma, you definitely fill as a diploma. You have to fill everything, just like we fill them before from high school. Now that you're applying as a degree entrant, you have to put your transcript and
Okay.
the certificates.
Okay.
Yes, but it's very, very competitive. I think it's usually like 1 or 2 slots per year.
Yes, that's what I had. That's what I
It's
had. But
very, very competitive.
and how much would it cost? Because that's going to come out of your personal pocket. It's how much would that
Yes.
cost you?
And actually, for me, I was lucky. Yes, it did come. Initially, I thought it would come out of my personal pocket, but eventually I got sponsorship.
Oh,
There's a lady I
good.
worked with, and she liked my work, so she paid for
Oh,
all my
wow.
school. So
That's
I've never had to
divine
pay actually.
favor. That's
I've
divine
never had to
favor.
pay undergrad government paid medicine. Someone, a philanthropist, sponsored me. When it came to my masters of medicine as well, I
Master.
was sponsored by the Uganda Cancer Institute. So I've just
Oh,
been lucky that
wow.
way. But of course, there are more opportunities these days for sponsorship in Uganda than it used to be. If you've been seeing the adverts, there are more opportunities because I think they want to scale up. Okay.
So where do we find this advert?
So,
Like the New Vision, Monitor,
they usually advertise ministry. For us, the postgraduates, they're usually the Ministry of Health, but they usually
Ministry of
do
Health?
trickle down to our circles anyway. When you're enroll, initially you may enroll when you're paying for yourself, but then you find the ministry wants to sponsor. I mean, in my, like the year after us, the ministry was looking for people to sponsor for radiology because they want to now, they want to improve the radiology infrastructure throughout the
Yes.
country, but there were no students to
Oh
be
my
sponsored
God.
because all
So
the
you're
students who
really
are available
encouraging.
were sponsored. Yes.
So you're encouraging people who have finished medicine, if they are still undecided, where do I go? Do I do internal medicine? Do I do pathology? Do I do pediatric?
This is a
You
very personal
consider,
decision.
but let them consider it because most times we don't think about, because when you do your internship, you choose a surgical and a medical rotation, but radiology is not one of them. Your discipline is not one of them, right?
Yeah, though
So
that the
people,
trends are changing.
Oh, good.
Even in Uganda, for some reason, it's in the limelight. You know, with the advances in technology, people are
Mm,
beginning, especially those who have practiced around Kampala and have used
mm,
this. They know,
mm.
if I'm a doctor, I really need some of these to be able to
Yes.
treat my patients. So actually, we have more students that apply, but few can be taken on. And that's what I was going to talk about
Okay.
next, that we are very few in the country. So if you're few,
Yes.
there is a limit to how many students you can train. As an entire
Yes.
country, somewhere, but I can just talk
Yes.
about it. We are only 50 radiologists in the country, the ones who are
50.
practicing here. 50. And that's roughly a ratio. You know, when I look at the radiologist to population ratio, that's like a ratio of one radiologist to a million people.
My
Okay. And
God.
obviously, we cannot cover the entire country. And obviously,
That's
we cannot cover.
crazy.
And this scarcity is not unique to Uganda, actually. We may even be doing better than many African countries.
Oh my
Okay, so it's
God.
a problem of Africa, so we need to really scale up,
Scale.
but it also trickles down to the infrastructure because radiology is more of an apprenticeship. Actually, you have
Yes.
to work with a radiologist, you have to use this equipment,
Yes.
you have to use that technology for you able to be able. You can't learn it in books, you can't learn
Yes.
it. You need both the patient, but you also need the equipment. Okay, and the
Yes.
equipment is very expensive. Of course, ultrasound and X-ray are more widely available. You can
Mm-hmm.
even find them in villages. But when it comes to the high or the more advanced technologies like
They
MRI,
are still, yeah.
CT scan, or we call them CAT scans, they
Mm,
are really in a selected few places where they're very
mm.
expensive. Most of them private centers that do not teach. So you
Yes.
find that
They don't
training becomes
teach.
difficult. But I know that it's on the agenda of the government to
Mm.
actually, you know,
Scale.
scale up, yeah, these radiology
Mm.
services to even the far. And if they really fulfill their promise, I believe that the situation will be better
Will be
in
better.
this
Okay.
country.
So for
Yes.
young people who are thinking about joining medicine and then SHOs, you're trying to do your masters, think about radiology because there's
Radiology.
opportunities for growth.
The opportunities are wide.
The opportunities are wide and there's room for growth even within the career because one of the things that we've been talking about young people who want to do sciences versus arts is because the more of you who do that course, the bigger the competition at the career level. The fewer you are, that means there's gap for higher, higher. And
Yeah,
so
definitely.
if you're out there, please don't hesitate to think about
Yeah, and of course, the
doing.
other part I didn't talk about because we don't have it here, but there's super specialization fellowships,
Mhm.
and that's what you people do in the US, and it's coming because it's been
Yes.
the agenda of the Association of Radiologists in Uganda. You can super
Yes.
specialize to become a neuroradiologist. You can become a pediatric radiologist, an interventional radiologist. You can become
Yes.
a musculoskeletal radiologist, and then you become the best in your field because the technology is so broad that there's so much. Even it sounds
Yes.
tiny, but once you start specialize, no one can beat you, at your game. So in Uganda, we're
Mm.
sort of a jack of all trades right now. We are general radiologists. I'm a general radiologist,
Yes,
and I think that's interesting
yes,
in its own way because I get to do so many
yes.
things. I don't think if I was
So
practicing,
many.
for example, in the UK, I'll get to do what I'm doing right now. I know they do have general radiologists as well, but they again do have super, specialists. So I
Yes,
do get to do
yes.
everything. I do get to do, MRI, CT, pediatric, women's imaging, ENT. Whoever sends to
Mm.
me a patient, I
You
can
you
handle.
do
And we are
it.
trained that way. We are trained that
Yes.
way. And of course, that's where we also want to head to become super
Mm.
specialists. But that can only come with the
Yes.
numbers. Once we get bigger numbers, then people can branch out
We
and
can
super
afford
specialize.
to. Yeah.
If I need this, let me see, what do I want to super specialize in? I'm still enjoying my
Mm.
general radiology.
You're generous.
Anyway, but
Yes, you enjoy it. And I think that's the one thing I really appreciate about like the training in Uganda. It prepares you so well because for us here, everything is very, very like if I'm a med surg nurse, I'm a med surg nurse. If you ask me about chemo, I'm like, I don't work on an oncology unit. Like, I don't know. The chemotherapy I know is the one I did to pass my exams, but I haven't practiced. Like, I'll need to be retrained to work on that unit. So that whole so I like it because Uganda really trains you. So when you end up in the diaspora, you kind of really have that broad base, and then it's easier to just narrow down to where you're going to practice. And same thing. So listening to you, if somebody wants to probably practice in Australia, is there a particular agency that hires
yes,
radiologists in Australia? Do you have
yes,
that information that you can share with us? Because some
yes.
people, Mm.
Yes, so that information is available, and most opportunities for radiologists who have not trained, there are no opportunities for radiologists in the US, no? You know that very well. You
I
have,
know.
yes, and even radiographers, by the way, I think they have enough. But in these
Mm.
countries, the main market is UK,
Mm-hmm.
Australia. UK
Mm-hmm.
and Australia and
Yeah.
Ireland, those countries. So what
Mm.
you do, you sit the exam. They have exam just like in the US, but these are
Mm.
specialist exams. They're called we call abbreviated FRCR, and it's a
Mm-hmm.
fellowship of the Royal College of Radiologists.
Mm-hmm.
FRCR,
Okay.
Fellowship of the Royal College of Radiologists.
Okay.
So there are three steps in there. The first
Mm-hmm.
step, you do study the anatomy. You know, the anatomy is a very, very big thing in
Yes.
radiology. You have to know that even
Yes.
the tiniest nerve and the tiniest vessels and the
Yes.
smallest
Yes.
foramen and
Yes.
ganglions in the
All right.
brain,
Oh my
things like
God.
that. So that exam of anatomy is very, very intense, and it's the entire body, yeah? Like from head to toe.
Yes.
When you dissect the brain, you can up to the cell level. Then you do a physics exam, and that's the hardest. That's step one, by the way. Both those
Mm-hmm.
exams are in step one. It's a physics exam because radiology is a technology. You
So
have to
step
understand
one,
the
you do
physics.
anatomy and physics mainly.
Physics, yes. And so most people
Mm-hmm.
fail at the physics part. The physics is
Mm, mm,
intense. You
mm.
begin studying those radioisotopes and anyway, so much that I won't go into electron capture and how they come in. And most of these things are abstract. It's not even like applied physics.
Yes.
It's like there's a bit of applied physics, but most
Mm,
of it is the basic physics. So you have to really be good at your physics. But if you do put in the time and study, definitely.
mm,
I don't think we go into that much detail because I've seen these materials before. In
mm.
Uganda, we study more of the applied physics.
Yes.
Okay,
And
and
yet
that
you, so the first exam, you need to have your anatomy and your physiology, your physics,
physics, medical
physics,
physics, actually
medical
radiologic
physics,
physics, and
and
this
the
physics
books
is the books are
to
available. Of
prepare.
course, you can't use the books are available. People have shared them before. We even use them to study here in Uganda. In this era where people just share information, so the books are available from the Royal College, even on the
Mm.
website of the Royal
On the
College of
website.
Radiologists
Okay.
(RCR).
Mm.
They are recommendations.
Of
Okay,
which
they
one
have
to
a
prepare.
curriculum, they have the curriculum, out there. So someone can
Mm,
look at the curriculum and then
mm.
study according to the curriculum. There are also question banks and things like that, and
Okay.
so many other resources, online resources to really
Mm,
help
mm,
you, and
mm.
also groups of students studying.
That's for that
Okay, so
exam.
someone can choose to join a group.
Mm,
It has mainly been with Indians.
mm,
I don't know only one person who attempted to from Uganda to study
mm,
that. He did, I think,
mm,
step one, then COVID set in, and
mm.
then I don't know if he has progressed, but at least he passed his step one.
So, okay. And then step two, which one is step
Yeah.
two? Is it still theory as well?
Just so step two is the more of a clinical radiology exam, but
Mm.
theory.
Okay.
And it's the entire body as well, MCQs and things like that. I
Mm,
don't know how many hours, I don't have them in mind, but I know it's several hours and it's a very
mm,
hard one because it's now the theory. Imagine covering all the modalities of every structure in the body. And
mm,
radiology, by the way, is wide. I didn't talk about the different modalities, but it's quite wide. And the
mm.
thing is that what the structure appears different on ultrasound, it will appear different on
On
X-ray, it will
CT
appear different on
scan.
fluoroscopy, it will appear
Yes.
different, and you have to understand that physics. Of course, the diseases remain the same, but you have to
Yes.
have a 3D kind of thinking. 3D, you don't
Yes.
think two-dimensionally because these images are in 2D, but you have to think
Mm. Really?
3D because our bodies are not two-dimensional bodies.
No.
Yeah, so
Yeah.
you have to have that kind of thinking when you
Yes.
interpret. Yes, so
Mm.
it's some people call it an art actually.
It is an
It's
art.
both an art and a science
And the
in a way.
science. Yes.
Yes,
Yes.
the ability, and then of course that attention to detail, because we deal with pattern recognition. You have to recognize the
Mm.
patterns of disease, and they are different. How a
Yes.
pneumonia will present will be different from maybe I may have lesions in that lung, like a chest X-ray I showed you,
Mm.
and I'll be
Mm.
able to tell that it's most likely lung cancer, and someone else can't tell the difference, and someone else
Yeah, you're
comes and
right.
said, "Well, it's
It's just a
bronchopneumonia."
lesion.
Or this
Yes.
is, a
Mm.
consolidation. So what will be the
Mm.
difference? It's the patterns of the disease, but those are all learned
Mm.
over time. And then the more
Mm.
you do, practice and practice, the more patients you see, the more condition. And I know it's
Practice.
similar
So
to
you
normal
do
like medical
exam one
condition.
is theory. So exam one is
Yeah.
theory, mainly anatomy and physics.
Yes. Then 2 is pathology. It's a clinical exam, all the diseases.
Mm,
And so that's why you have
mm,
to bring your pathology, microbiology, all that into the whole mix of radiology
mhm.
and understand it because they do usually request even for how you manage the patient. Patient management is part of that exam as well. So
Yes.
that's step 2A. That is
Mm,
the second exam. And then
mhm,
the final exam is step 2B.
mhm. Which
So
is
in
what?
step 2B,
Mhm.
it's you interface with the examiners. It's Survivor. They give
Oh, wow.
you simulated cases, and then
Mm,
there are long cases and short cases, and there are several of them, and you go through them. But they try to have a good mix of all the common
everything.
diseases, then some
Mm,
rare diseases,
mm,
then different disease patterns, congenital versus acquired, inflammatory,
mm.
different things, and all the different body structures
Yes.
are represented in that, and then you're able to talk from, when the patient comes in, what if the, first of all, as radiologists, we're supposed to gauge if the investigation requested is appropriate for the patient, because many times
Yes.
clinicians actually
Because yeah,
request for
many times
investigations
the
that
other person might
are
just order
wrong.
and you're like, this will not.
Yes. So as one of the
Because we
roles of the
always have
radiologist
to
is actually
attach a
justification.
diagnosis
Yeah.
and
So one of the so they they do when they assess for such, is that the appropriate exam that was done in this
mm,
patient anyway. And then if it was okay, they can project an image like the images I showed you, give you that
yes,
history of the patient. So they
yes,
ask you what you describe your findings, you tie it together,
yes,
and then you give recommendations. For example, in that case, I showed an X-ray and a CT, and you're seeing lesions, but we don't know what these lesions are. So you recommend a biopsy. Then they ask you just any biopsy. It has to be a CT guided biopsy because the mass is within the lung. You just
yeah,
can't stick in the needle. Then
I
you cannot use
know.
ultrasound because ultrasound is not the best modality for imaging the lungs. So there are things like that. But here you interface. And if
Mm,
you've been a practicing radiologist, then it becomes easy.
it's
And if you've
easier.
been a teacher, then I think it's even easier because you're always speaking out these things.
Yes.
Yes, so that's the last exam, but that trick, it's very, very tricky to get a place.
Mm. So
Yes,
once you pass all
actually,
through exams, then you
mm,
get a certification that you have passed.
yes, you become a fellow.
You become a fellow, and then at that point you start to look for, you apply for schools or
That
for
they will
those.
look for you, trust me. They've called me without that certificate.
Wow.
There are even organizations that are willing to sponsor you.
These so I will maybe you kind of send me a message so we can attach some of those organizations so that if
Okay.
people to this
So
video, so that if people want to,
the main issue is to get a slot to do those exams. It's
where do
highly
you get those
competitive.
exams done? Where do you
The
do them?
exams are done, I think, in 5 countries, UK
Hmm.
being one of them, five
UK.
or 4 countries. UK
Mm,
has several testing centers,
okay.
but
How about
COVID messed
Africa?
up everything.
Mm,
Africa, there is Egypt, but only for, I think, 2A. I think it
oh,
has just come on board.
okay.
And then the other countries, Hong Kong, Singapore, and some island, I've forgotten the name of
Okay.
that island.
We'll stick to the UK because it's closer to Uganda if people live
Yeah,
in
but now it's
Uganda.
very, very hard. UK, when they give you patient, people usually don't get visas.
Mm,
So that has become a deterrent, and that's why they're advocating. The easiest countries to go to, I think, are Hong Kong and Singapore, and they're quite expensive.
oh,
And even
wow.
their exams, whether the exams are, the fees are not the same in these countries.
There are
UK has
more.
the cheapest. Yes.
So the UK, how much
All
is the
countries.
UK? How much is the exam in the UK?
The exam, it depends on the state. So
Mm,
I'll just give you rough figures because I don't have them.
yes, people
But the
can go to the
exam
website and find out.
yes, so they're
Mm,
around, like, the exam itself is not very expensive. I think per
mm,
paper is around £300
okay.
for step one per
Mm-hmm.
paper.
Mm,
Then for step two, I know the fees are higher. The last 2B, they're even higher. But
higher,
the issue is
okay.
about the visas and accommodation.
And
And actually,
transportation.
I've actually once offered this. I attempted to apply as a student
Mm.
because people, it's so difficult to get in. So I applied. I wasn't expecting to get. That's why I know all this information. And I was given on my first attempt. So I couldn't
Oh,
travel because I was doing exams and defending my thesis at the same time. And
yes.
that's when COVID struck.
Yes.
So they anyway put everything on hold.
On
But
hold.
prior to that, I know a colleague who traveled and did his step one, but then
Mm.
COVID struck and everything is sort of
On
on
hold.
standstill for students, sorry, for doctors outside the UK. But that's not the only exam.
Mm.
There's another exam, I've forgotten its name, for Australians.
Yes, that's what I was going to say. That
Yeah, it's
if you want
called
to practice in Australia.
EDIR, something like that, European Diploma in Radiology.
Mm.
But if you can study for FRC, this just has a different name. But really, when I looked at the material and the structure
It's
of the
the
exams,
same.
it's the same. So most people who sit for the FRCR sit for the other one as well, because if they
Eh.
have the money, so they do get two qualifications. You get that European diploma, but the
Mm-hmm.
European diploma does not work in the UK.
Mm.
It only works in these other European countries.
Okay. So the
Yes, it
UK
does.
has
And
its
actually,
own.
Australia actually has its own exam.
Mm.
It's a radiology year, but it's similar. I looked
Yes.
at all of them and they're really similar. I've forgotten the name. But
Mm.
Australia has its own exam. I haven't heard of anyone who's going at the radiologist level there. But I know that that European diploma is quite popular because
Mm.
the structure is very similar to the FRCR of
And
UK. So
yeah,
most people do it. They do both. So that when they get an opportunity in any of those countries, they
they
can
are
go. But of course,
ready.
UK and other English-speaking countries are easier.
Mm.
They have very few. They also have a shortage of radiologists. I've got several calls, several emails. I think once I
Yeah.
enrolled for that exam, maybe
Mm.
to them it's an expression of interest. And then I keep on telling them I don't have FRCR, and they get very, very surprised. But some of them are even willing to, sponsor
To
you for the
sponsor
job.
that. So
Yes, but there
which
is,
are some of the organizations, like the agencies that do assist
they are usually private. These are usually recruiters, of course.
recruiters?
Since I
Yes,
always find them down, I never really get to know
the
their terms of the
information.
work, but
That's
I
okay.
could
I
look
will do
at,
some research and
and I'll also send you some that
some
actually
info.
contact me as well. But
Mm.
there's also another route of
Yes,
practicing in the UK.
which is
It's called MTI,
mm-hmm.
Medical Teams, I think, Initiatives or something like that.
MTI. Okay.
And for them, it's a going and return policy.
Mm.
You go, they train you. So, of course, you're not paid as highly because they are training you.
Yes.
You do like sort of specialize while working.
Mm-hmm.
And then after 3 years of training, you're supposed to return to your home
Okay.
country. It's part of a
Mm.
global radiology initiative. It's highly competitive as
Nice.
well. And
Nice.
they usually have very few slots.
Mm. But you know
But
what? I
actually,
always tell
it's not
people.
just for radiology. I know that even other disciplines, but I know radiology mostly because it's
You
where
are
I
a
belong. And
radiologist, yeah. And I
yes.
always say, you know what, your luck is different from the next person. So you apply, and who
Mhm.
knows where God, especially the Bible says the footsteps of the righteous are ordered of the Lord. If that's his will, he will order your footsteps to that place and your application will stand out. Don't be afraid. I think people, as long as you've done your preparation, do your part, prepare well, and then apply, and then leave the rest to God to determine where he wants you to
Yes.
serve. Because
Yeah,
I
definitely.
honestly believe our calling, our work is our service. Like we touch people's lives. You probably going to be the only person the person will talk to. People live alone. Here, the 80-year-olds and they live alone. That visit, they're coming to see the nurse or the doctor is the only time they're going to talk to a human being in person for like maybe a month. So it's service, and I don't take what we do lightly.
Yeah.
Dr. Joyce, do you have
Yes.
do you have any more slides that we missed that you want us to
I
present,
have talked about
to
everything.
go over?
No, I think you can just scroll through them, but
We
I
talked
think I've
about
discussed
everything.
everything.
Our
I've
ratios,
discussed all
yes,
that, and yes, maybe
yes,
I'll just re-emphasize the role of that's interventional radiology. I can briefly talk about it. So, interventional
yes,
radiology is really a very baby, should I call it baby? It's a very young discipline in Uganda, and it's where I really perform
mm,
minimally invasive procedures using imaging guidance. Commonly for us, we use ultrasound. Just like you see in those images, the
yes,
patient had a lesion, and we needed to find out what the
mm,
lesion was. It cancerous or not? So you can see the doctor prepares his instruments just like they're in theater, but then you use a small,
mm,
needle to get in, pick some of those cells while you're
mm,
seeing them on the image. up here on ultrasound,
Yes.
and then you can be able to diagnose. So we do a lot of biopsies, which are ultrasound guided, as well as aspirations. So we can treat emergency conditions like a pneumothorax. You see it under ultrasound, and then you can put your tube, so that you don't puncture the lungs, and then to drain that air out of the lung, and the tension on the lungs is released, or fluid collections in the chest, like pleural effusions, we do drain them, abscesses
Mm.
deep in the body, you don't have to cut the patient. So that's a kind of interventional radiology that we perform. But of course, we know that interventional radiology is above and beyond that. It's used in theaters to treat those life-threatening complications, to treat fibroids, embolizations, treat cancers, where you do targeted medication in the developed countries. And we hope as a country that's where we'll get. But yes, that's interventional radiology. It's really still developing in Uganda, but we should
Interesting.
be there.
Yeah.
And yes, I think I've actually started performing those procedures. That
Mm.
was just a group of us in May doing. We're also involved in continuous professional education. Personally, I'm very passionate about research, deriving solutions to our own problems, homegrown solutions to our problems that affect us. So that's another part that maybe I'll discuss. I know we talked for a long time. Yeah, I love global radiology. I love reaching out to communities. And the last thing was mentorship. We should really be involved in mentoring the next generation of doctors. It doesn't matter, the profession. Personally, I'm a radiologist, but I can still talk to someone who wants to become something different, because anyway, as a general doctor, you do get a feeling of everything. But mentorship is very important. I believe it's because of the mentorship that I am where I am today. I would like to thank the many people who have been there with me on this
Yes.
journey, my professors in medical school, my
Mm.
family, as well as my husband. And thank you so much, Beatrice.
I know.
I've
And
enjoyed it.
Dr. Joyce, and I mean, and you're so Dr. Joyce, I know you're married. Thank Mr. Kasuja for letting us borrow you for this one
Yeah.
hour to share your experience. How is that balancing, being a family person and career and all that? And I know you do a lot of traveling too. How is that? Because that's a big struggle, like right now as an adult, and especially in the diaspora, like finding that fine balance, like family and career, and even just friends. Like some people are not yet, that they don't have spouses, they don't have their partners, but just family, like their siblings. Like I said, I'm a sister, I'm a daughter. I have to remember, I'm like, I have to call my mom, I have to check on my dad. Like being very intentional. How do you balance that?
Okay, I think, how do I even balance? I think naturally I'm a busy bee. You remember me in medical school,
Yeah,
the kind of person who multitasks, and I don't
which
even
is
feel it.
good.
I
Which
do
is
a lot of
good.
things at the same time. I think that's how my brain works. And actually, if
Yes.
I'm not doing anything, I'm very miserable. If I'm not busy,
Yes.
I sort of look for work, I guess. But what helps is I and my husband, I think we are very similar. We are
Yes.
both busy people, yet we do find time for each other. So we
Good.
understand what
Yes.
each one does. Because my
Mm,
husband travels, before COVID, he used to
yes.
travel quite a lot. And
Mm,
so he does that. I mean, he can't complain about
yes.
my traveling. But I guess it's understanding each other and supporting each other, because we are all, chasing the same thing,
Yes.
supporting your spouse and make sure they achieve their dreams. So
Mm-hmm.
it's understanding each other and we make it work, our timetables and all that. We find time
Mm-hmm.
in our schedules to just go
Yeah.
out and have a good time.
And have a
So
good
things like
time.
that. But
Yeah.
basically that's who I am. And I
Mm.
think I married a person who understands,
Who
who
understands
understands.
you? Yes.
Yeah,
And I think
because
that's
I'm the kind
important.
of person I can be on this board, like so different, responsibilities. You're
Yes.
the general secretary on this board. You're the who on the other board. You're heading this team. You're
Mm-hmm.
organizing something else, and you're supposed to see patients here. And I don't know honestly how I do it.
I think God. I always say like there's a
Mm,
grace. There's
I
a
think
grace.
yeah.
Yes, there's a grace right now to carry that. Like
Mm,
when I had just moved here, like 10 years ago, well, maybe 7 years ago, I had grace. I could do so much and I would mobilize like 1,000 youth and we do all these great things. Now, Joy, I
mm,
only have strength for two people, two little people. And even that strength, I'm like,
yeah.
I need grace. So when there's grace, you'll be able to carry it. But you said something very important. I think it's important to understand the other person's goals and support them so that there's no
Yeah.
resentment. Like 20 years down the road, you're like, I could have done more, I could have been better, but you kind of stifled me. But you have
Mm,
you're supporting each other to kind of be the best and the maximum that God has ordained you to do, which is exciting.
mm,
Well, thank you so much.
mm.
I know your time is
Thank
limited.
you so much,
Really
Chris.
appreciate you being on our chat. I'm going to make sure that all the information I will listen and attach it to this video so that everybody who kind of wants to know more, young people who are joining college, both in Uganda and anywhere in Africa, because this knowledge translates even to people who are on other continents, not just Africa, trying to get into Australia or the UK, or trying to think about radiology or radiography. This will be relevant. So I really appreciate your time. Thank you so much. If you have just joined us, this video will be available for you. This is AfriCent with
Yeah,
BT. Don't forget to hit the like button. Don't forget to share. Don't forget to hit the notification button every time we have a new video. AfriCent with BT, where we're about diaspora, transitions, balancing adult life, and all that good stuff. And our guest today has been Dr. Joyce Naiga Kasuja, talking about the transition from radiography to radiologist, to medicine, then to radiologist. I still have, it's like a tongue twister in my brain, but I thank you so much. I'm excited. You've actually inspired me. I'm going to hunt down another physician I met here on a group chat that is a radiologist. Went to high school here, went to college here, and now has just finished. I think he's practiced for 2 years. So I'm going to track him down. So we have that video, and if somebody watches your video and his video, they can kind of
yeah,
have a broad picture of what you guys are talking about, the exciting stuff. So thank you.
yeah.
Enjoy
Thank
your
you.
weekend. We'll talk to you
Yeah,
soon. And if you remember anything and you want us to attach to this video, please don't hesitate to
yeah,
share it so I can attach it to that video.
yeah.
All
Yeah, thank you
right.
so much, Beatrice. I've enjoyed sharing my experience. Please invite me again.
Yes. About so many.
Yeah.
And when I come to Uganda, and okay, Dr. Joyce, where can people find you? Like if somebody says, okay, one of the things we struggle with is when our family members in Uganda get sick and we don't know who to. Like now I know you are a radiologist. Where do you practice? Where
Mm.
can people here send their people to? Because that's something we kind of look out for.
Okay, so mainly at Mulago
Okay.
Women's Hospital,
Okay.
and then I'm also at Kampala Imaging Center Kololo branch,
Okay. Kololo
and
branch.
I do as well project work, and there I'm not seeing patients with
Mm,
Imaging the World.
mm.
Yeah, so basically that's where I am.
Well, thank you so much. Enjoy the rest of your day. Thank you, everybody.
Yes.
All
Okay,
right.
bye.